Access to safe, voluntary family planning is a human right. Family planning is central to gender equality and women's empowerment, and it is a key factor in reducing poverty. Yet many women in Kenya who want to avoid pregnancy are not using safe and effective family planning methods. In this special series, in partnership with FilmAid Kenya and UNFPA, we focus on family planning in Kenya.
We have good men, I'll say. We have good men. Depending on how you approach them and the skills that you've been given from Robina and Tim, we hear from them, then talk their language. Talk to them in the simplest way, the common language that they can hear in the community, and then it will make them understand. We even give them real life examples, and we tell them, you know, like when my wife was pregnant the other day, you saw me, we met, you know, and they are able to copy. So, you mean it's not stupid for me to walk with my wife to the facility?
You're not less of a man.
Yeah.
Hello, welcome to the One Health Lens podcast, where we have conversations around health and related topics, making it simple and easy for you to understand. I'm your host, Dr. Diana Wangari Gitau. We've been having a conversation around family planning in Kenya, contraceptive use, uptake, and I think the last time we had a conversation around the myths and misconceptions. We had amazing really, conversations and discussions, and we had stories from communities. People believing that family planning means that, number one, you're promiscuous. Family planning means you'll not be able to have children. And we had to ask one of the guests to come back and bring people from the community, people working with the communities, to tell us what's the human impact of contraceptives and family planning. So in studio today, we have three guests. One not so new, the rest are here to tell us the impact story. We'll start with Robina. Karibu tena.
Asante sana, Dr. Diana. Yes. Again, pleased and humbled for these studios to host me, just to support the conversation around contraception use and family planning uptake for our communities. My name is Robina Anenemuli. I support reproductive health services from the County Health Office of Nairobi.
Nairobi, thank you.
Thank you.
My friend?
Thank you. I'm Peter Mutinda, a community health promoter in Mukuru kwa Ruben, and a ward representative of community health promoters. Yeah. I'm passionate around working with the youth, fellow men, yes, and the community entirely.
Absolutely, asante. Karibu, Peter.
Thank you.
Hilda?
Hi, I'm Hilda Obara. I'm a CHP from Embakasi East, Nairobi County. I'm working on how to minimize the misconception of family planning in our community.
Absolutely. I'm happy you're all here. I'm happy Amel is here as well. It's important. I mean, it's one thing when we have these conversations in studio, and it's another when we have people like you, Hilda, Peter here to tell us what you deal with day to day. Because now it's not a conversation we're just having for the sake of it. It's a conversation where you're telling us about your day-to-day activities, right? So maybe let's start with you, Peter, right? First, as a man who's an ally, right? What led you to this work, right? Because most people would say, very typical in terms of maybe some of our traditional and cultural practices. There are some things which I always thought, ini kazi ya wanawake. This is work for the women, right? So what led you to this work?
Oh, wow. Thank you. I'll tell you, it's not easy for a young man like me to be in this field. It's passion. One, you need to see what the community is going through, be passionate, and have that humanitarian heart to want to take people from somewhere to a different level, make them understand something, and make them go to another level in health matters. And we'll never talk about health without maternal health and such issues. And I felt I'm at the right field. Because when we curb it at the level of being a youth, you know, if we curb issues to do with family planning at the level of youth, I think it will be so good when they become now parents, and it will have a good community. That's where it's at.
And you know, and community health promoters, Robina, to be clear, work within a certain location, isn't it?
Yes.
Right? So
Each
then,
community health promoter is assigned 100 households, and one of the households must be their own household. So these are people who are identified by the community. The community trusts them with information because they have demonstrated features of being leaders, and so the community look upon them for some level of information. So yes, the community health promoters are actually sourced from their own communities and serve the households within their space.
Okay, so then Peter, maybe it will be important for you to give us context of what your community is, this location, who lives there, right? So that people have an idea of, you know, when we are talking about community, what that really means. Yes.
Okay, thank you. One, we are in Nairobi, a city which is so populated, highly populated, and within Nairobi we have slums, and that's where now I'm coming from. We have a slum called Mukuru Kwaruben in Embakasi South sub-county, and it's Nairobi County. Slums are known for a number of issues. One, we have issues to do with poverty. People are taken there, they go there because they are poor. So many, they are hunting for jobs and such things. Another problem facing slums is that they are overpopulated, and we have these other issues around the same overpopulation. You see, when people are so many in a place and they don't have something to eat, whatever, no jobs, nothing, it leads to insecurities, and this will take its roots back into family planning. You see? Because if they had family planning, we could not have these high numbers. We could have kids that are easy to feed and manage, could take them to school, feed them, clothe them, and such things. That's where we are. Yeah, Mukuru is overpopulated. Actually, in Mukuru Kwaruben, we have very high numbers, and like, actually the requirement is, if in every 3 months, you could be going back to households and you'll find it's different people in that household. Yeah.
Talk of teenage pregnancy.
Yes, we've teenage pregnancies, actually school-going kids, as young as 12.
As young as 12, yes.
Yes, are getting pregnant, and there's a lot of neglection from their parents.
Yes.
You see, we still have, I'd say where we are placed right now, we are at my age, a generation that is trying to fight traditions and trying to fit into modernity. Like in modern day society, we need to embrace our kids. We need to love them, talk to them, and literally, we have very few fathers talking to their daughters about family planning. Very few, literally. And our mothers will be there, and they'll tell you a lot of myths, a lot of misconceptions about the same thing, contraception we are talking about. In schools, we have teachers who still believe we need to talk about what do you call it, menstrual health, only to ladies. Leave the boys in the classes. So this is the girls' talk.
Yes.
Boys need to be involved into these things, and I think that's we have a gap. We still have a gap, and that's why we. That's the setting of a slum.
Absolutely. I mean, and I absolutely understand, because in an urban slum, as you said, yes, it's overpopulated, but because of the social economic conditions, that means then either even the parents are out there out early in the morning,
Yes.
back in the evening, the children are taking care of themselves. So a young girl of 12 years old is very easily to be diverted in other ways, and depending on what conditions they are living in, it might even be something that they are pushed towards, right?
Yes.
So then it's something that necessarily they cannot control, but the only way you could potentially give them power is in education and the knowledge to know that these are the choices you have as well, right?
Yes, exactly.
And
Actually, in addition,
yeah,
these kids, most all young ladies, school-going kids, they are subjected to, and everybody should have, maybe Robina has a good chunk of information.
yes,
These kids, once they start, they get the childbearing age, you see there's menstruation. And to deal with this, we have irresponsible parenthood within slums, right?
Okay.
So these parents don't want to take care of their dignity packs and such things. So these people will fall in bad hands of, I don't want to, maybe in quotes, like border riders who are, well, we have some who are so well, but some are ill-mannered.
Yes.
And they now start giving them like 20 shillings, and they end up impregnating the same kids. We still have another very, very bad habit within that we still fight when we visit the households. We'll still find this kid as young as 12. They are the ones taking care of their basic needs. The parents are sunken into drug abuse. They are drunk day in, day out because there are no jobs.
And so in most cases, you'll find that some of these girls engage into sexual activity because there is a need they need to fulfill.
Yes.
And so if they encounter someone who is willing to give them even as low as 50 shillings, they would easily give in.
Yes.
And that is where we come in to provide contraception for the aged young team,
Yes.
so that they are able to at least push their worth of life by taking up contraception, so that they are able to at least mature and be able to take care of their needs in a way that is not going to compromise their future. Yes.
And it's such a powerful message there, because it's not so much that they can do something about that situation, right? If you have, as you said, maybe parents are in drugs, alcohol abuse, you're the one who has to find a way to first get food, and probably you have siblings in the house, right? You are, say, a young girl who then potentially will be enticed by, in many cases I've had Buddha riders, for example, who'll say, here's a 50 bob, right? And it could be this is the only way, right? Because maybe they cannot work, right? So it's really something that in many ways people always imagine that, oh, why don't you teach the girls not to take that money? But you need to eat.
And who is there to teach them?
Who's there to teach
Most
them?
of the time, our parents are out looking for a livelihood, school fees, the daily basic needs for the family. So when the parent is away,
Yes.
this 12-year-old, as the guys who really serve in the slums, Mukuru kwa Ruben and Mukuru kwa Njenga, the Mradi slums, have rightfully said, these young children and young girls are the ones who are left with the adult responsibility to take care of their siblings. And it is during that disconnect that a lot of mess happens. And so we get our young girls getting into pregnancy, and that is why we are providing post-pregnancy family planning and contraception.
Absolutely. And Hilda, coming to you, I mean, you also a community health promoter.
Yes.
You've worked particularly within maternity settings. What has been your experience been like?
Okay, thank you. Before I comment, let me put some more effort on the young children or the young girls to get pregnancy, you find that the socio-economic is very, very low in our community where we came from. And then as parents, they have poor communication between the teenager girl and the parent. So when this gap is there, the lead, whatever the lead needs to be taught by her mother, she'll even get from outside. And this leads them to involve in it sexually. And then another thing is poor relationship with our parents. Girls, they are not ready to open up for their mothers. You just find them, they're just looking advices from outside, and it leads them now to get even pregnant. And now later on, the parents start complaining about what have you done, and yet you were not having any time to sit with your daughter to tell him what should be good and what is bad, and then. As a community promoters, my work and my responsibility is to create awareness to these families. Between the teenager girls' parents and I'm a parent, even if their father. Just create them and tell them what is there. Nowadays, we have no fear of not talking anything. Just say so that you can save this child. Okay, you're asking about the maternal. What have I experienced?
In fact, before even we go to maternal, you bring out a good point around there's no fear. Right?
Yes.
So you work within a community.
Yeah.
You, as Robina mentioned, as a community health promoter, you came forward as a leader within your community. So you live in this area, right?
Yeah.
So what made you, particularly as a woman, right, to come up and say, I will be a community health promoter, right?
Yeah.
What made you, first of all? Yeah.
Okay. One, what makes me to come a community promoters, I just sat down and I saw how I came up on my village where I came from. I thought wisely that if I was taken to school properly and I was even to follow up very closely, I would even perform well in school. But now this is a young lady who is now carrying a baby, maybe is carrying something which is not even pushing her on. I started thinking of myself, and we have jamas. I started with the mothers. I told them now we want to come up to start talking about these things. So mainly what makes me to come up with us to being a CHP, I decided to help these young ladies. Actually, we have so many ladies. They have just come even to my house. Being a mentor, being a CHP, I'm also a mentor. I am still mentoring around 15 girls from my community. So actually, they just trust me.
Yes.
They know I will help them and I will keep them ongoing, because you find most parents have no time. We are just up and down looking for what we can make to our table. So most of the time I just call them even on our weekends. We just sat down. If my space is small, I just even take them to the facility where there's a space. We just talk. We just have one-on-one conversation. So this lady can be open up, say, Mom, I have this and this, what do I do? So that thing makes me, and I'm not going to spread it to the family or the mother. I just go with that lady, slowly by slowly, so that you find that this lady is out of danger.
From the health facility perspective, we rely a lot on the CHPs because they open up the conversation box between the young girls and their mothers, because remember, we need to have consent for them to take up the contraception. And so the connection between the parent and the young person who wants to take up contraception is actually boosted by the conversation with the CHPs and the parents. And so if they are made aware that yes, your girls are young, but truth be told, they are engaging in sexual activities. And so would you come and support them, and for them to be able to make an informed decision on contraception uptake. Yes.
That's a good point, because it's creating that safe, fast space that they can come talk to you. Then from that, you're able even now to bring in the mothers, the parents, and there's an openness to having this conversation that could potentially, maybe it was just the daughter who was coming in, but the mother now benefits, and the entire community, right? Absolutely.
Actually, in addition to that, from experience, I've discovered that these kids find it more safer. If they find it better to share with the community as promoters and the teachers in school than their parents. They disclose it to you openly. When I was having I was just sharing with Robina a few minutes ago. In my session last Wednesday, I asked the youths about what are the common methods they know about family planning. You know what one of the ladies told me?
What?
If you're a man, go and impregnate your neighbor's wife, not yours.
Wait, what?
But well, they opened up, told me really many stories, lots of stories, and they emptied their myths and misconceptions to me, and I felt okay. There is a gap, and the ladies, there are some women who are looking from a side, and they told me, look, Peter, we need our sessions because we have liked what you're telling the youths, but we need it on ourselves because we cannot be learning with them. So our mothers as well, they are lacking a lot. Yes,
absolutely. And there's back to that point that, you know, people would assume now that you're a mother, maybe you know some of these things as well, right? And I'd want to go back to the point around now maternity as well, right? Because you've delivered, right? Say you have had a child, you've delivered, right? But you're still in this community, right? Chances are that if nothing is done, right? If you don't have the information, you'll have the second, third, fourth, fifth, right? So what typically, especially since you deal with girls and subsequently even mothers as well, what kind of conversations do you have if they've delivered then?
Okay. Before even delivering, we start telling about them the family planning. That one in the back of the mind now, when it comes out, she says, okay, I had something called family planning. So after getting part, it's very essential and it's very easier for her to get immediately. Because out of 10, you find 9 of them, they have that family planning. Called PPF. So after going home, you will heal together. You are healing. If you had a vasectomy, you will heal at the same time. You cannot go home and then you come back. After going home minus family planning, any methods of family planning, you will come with another pregnancy. So we just encourage them immediately after they have arrived at our maternity.
What does that look like, right? So my understanding, and I know Robina mentioned this before, was that then as they deliver, they get some form of family planning. But what does that look like on the ground, right? So you have these conversations just before they deliver, even when they're pregnant before they deliver. So you're having conversations telling them that when you deliver, it will be important to consider these options. So what does that look like? So they come to the facility. Is the facility ready? Is there a particular kit? What does it
Maybe
look like?
Maybe you help us walk the journey from the time they are pregnant through the antenatal and how they end up leaving the facility with a method.
Actually, it looks positively. One, we start from our community. You just give education. You tell them about the family planning. So you just work with this mother until she gets out with a baby plus method of family planning. And actually, whenever you get them, they just tell me they are working good. I will never leave it. So this one, it helps me to know that I'm working. Because the moment the mother goes home with methods of family planning, it helps her even to heal mentally, to heal physically, and even to have time to purchase. How many kids am I going to get? So this one we are giving immediately after birth. It's so nice for them, and they are advocating for another mothers. Yeah.
Robina, is it there are limited methods or are there certain guidelines? Yeah.
By the time we are delivering a method into your system, we are very sure that this method is safe for both you and baby.
Yes.
And so in most cases, we will give you a method that will not interfere with the baby's milk.
Yes.
And especially remember, as Hilda says, you are walking out of the delivery bed in labor ward with a method. Our expectation is that when you are in your postnatal period, you are able to breastfeed, and so milk production, we would not want to interfere with the milk production. We would not want to interfere with your system. And so using the MEC criteria, we are isolating the methods which are very safe for both mom and baby. And the conversation begins when the mom, in the community, of course, they create demand for us.
Yes.
By the time the moms are coming to the facility, they have an idea that there's a conversation around family planning. And so when they come to the antenatal space, the teams in the antenatal room again emphasize and now open up the methods to them. So by the time they are closing up to delivery, they are already aware that this is the method. And that's why Peter actually again speaks into the conversation, representing the men and the young couples, that this conversation is very important to the pregnant women when the men are involved, because they participate in the decisions of our health. And so bringing on board the men before, during pregnancy, adds a lot of value in making a decision for this mom to step out of that bed with a method. And from experience, the men who have been involved in the care of their pregnant spouses normally walk the journey through even after delivery. I have encountered several men, in fact, who have come and thrown parties to the facilities that we were working. They could not imagine the care, and that they are even being considered and involved to the point of their wives leaving the delivery room with a family planning method. And so again, this is a very positive conversation for me as a reproductive health coordinator in Nairobi County, bringing on board all these stakeholders, and again through UNFPA, availing the commodities for us in the system to be able to increase access of care, so that for every opportunity that is availed to us, we are able to deliver a method to our mothers.
Absolutely. I mean, Peter,
Yes.
you know, a lot of people say that one, as I said in the beginning, this is a conversation for the women, right?
Yes.
What do you hear from the men? You have touched on the youth, but what do you hear from the men? What do you hear from them generally, but also how do you get to that point where a man is involved?
Which kind of a man do we have in the community? In the first, it is a man coming from the village, a man with all the traditional beliefs and all the cultural practices. This tells them, and they will tell you, going to the clinic, to the maternity with my wife, it's something that's
It's a woman's business.
It's a woman's business.
In fact,
yes.
I should not even take her there unless she can't walk.
Yes.
So ours mostly is to change them with narratives and good stories and all the necessary key points that they need to hear at that point. And thank God we have Robina and the teams, that the other staff who have been training us. You see, you learn about communication, their social backgrounds, and where we are.
Yes.
And we are able to change them. Trust me, they've told us many stories. But
Give us an example of the stories. Tell us.
they will tell you, oh, you know the mama story. The mama. Oh,
No.
that guy is a mama. He takes his wife to the facility. You know?
So he's less male because he takes. Okay.
And we go to their social joints. You know,
Yes.
they have their base. You know, like the border stage.
Yes.
We have their other sites that they hang out
Yes.
in the evening after job. We go there. We first listen to them, and then we start selling our ideas to them and the benefits. Oh, we have good men. I'll say we have good men. Depending on how you approach them and the skills that you've been given from Robina and Tim, we hear from them, then talk their language. Talk to them in the simplest way, the common language that they can hear in the community, and then it will make them understand. We even give them real life examples, and we tell them, you know, like when my wife was pregnant the other day, you saw me, we met, you know, and they are able to copy. So, you mean it's not stupid for me to walk with my wife to the facility?
You're not less of a man.
Yeah.
Yes.
And I am liking the standards that Robina and Tim are setting in their facilities, because even an attendant who's there, when they see a man coming with a wife, they treat you very well. They actually they take
There's
you as a
respect
priority.
of.
Come, let's talk.
There's recognition that you
That's
have really
recognition.
made an effort. We applaud you for coming with your wife. Okay.
Exactly.
Yes.
And again, added value
Yes.
to his time. This man has put aside all the other engagements to support their pregnant woman in our facility. So why wouldn't we take a BMI for him? Why wouldn't we take his weight? Why wouldn't we engage him with a counselor as they test for HIV together? What does that mean to this family?
Yes.
So we are adding value to the men's time, accompanying their partners
Absolutely.
to our facilities.
And
like that
do you see,
approach.
like for what Robina said,
Yes.
taking an HIV test for both of them.
Yes.
I've met so many men in the community, and they tell you, you know, I don't need to test for my HIV. What I'll do, I'll just impregnate my wife.
No.
Yeah, when she goes to the maternity, the day she comes back, and I'll look at the mood and I'll read everything
Yes.
and have my test done.
How about the discordant couples?
Yeah, exactly. You
So that's
wouldn't.
what the kind of man we have been having. But I think we have a very good number of men that are now changing and improving. They will even tell you stories, and you will find them advising young girls within their small enclosures. Look, if you do this, this will happen. If you do this, do this.
Yes.
You don't need to do this.
Yeah.
Imagine that coming from a border rider. The ones we've been believing they are perpetrators.
Yes.
And now they're the ones who are changing.
Champions. Yeah.
Behavior change, starting from where the root cause of the problem has been.
Yes.
And I've been liking that.
The
honestly.
other approach, again, in increasing access to contraception and family planning methods is outreaches, taking services to where the community members are.
Yes.
Because sometimes some women might just not come to line up in the facilities because, again, they do not want to lose on their business, like the mama mbogas, the guys who become andazi on the streets.
Yes.
They see leaving a whole maybe 3 hours to go and queue up and take up a method might be too much to ask for. So they assume and like shy off from coming. But then as teams, we have, again, through support of very many partners, we have come up with an approach of taking services to them.
Yes.
We may not do it very frequently because, again, of being constrained in resources, but when we take services to them, they are able to quickly, like, ask their neighbor to look after their staff come take up the method and go back again in reaches. There are so many other approaches that as a county team we are using to reach out to our young people and to access the services.
I mean, I wanted to ask Hilda, because I see you're wearing the community health promoter jacket, right?
Yes. Yeah.
Of course, it serves as an identifier that you're a CHP, right? Yeah. When you're walking, I mean, this is where you also live as well. Is it a positive thing that you have been identified as a community health promoter? Does that help? Or do people then have negative attitudes towards you? Is it on a positive?
Yeah, thank you. It's on a positive because initially we were not wearing our reflectors, but nowadays people are recognizing you. They just know that that one is a community promoters in our village. If anything happens, let's say outbreak of cholera, outbreak of TB, they just come ask what will we do. So as a community, I just make sure I have sent the message, or I have taken the message to the public health facility where it's supposed to be done. If it is a drainage, they just come in. So when they saw me with this one, even I'm not even wearing, they just know that I'm a CHP. And they actually, we have a lot of respect in our community nowadays, because they know as much as we have any problem, the response will come first from the community. And then nowadays, nobody will come to our facility without any referral. We have our EHs whereby we refer people from our phone. So when you reach that facility, you find already you are there. So it's actually makes us even as easier to interact with our people. Again, about family planning, about the maternal, I would like to say that nowadays men are supporting our women because
Peter's work.
Yes. Good job.
Because we have seen them. Even giving birth, they're just at the back of them, just rub them gently. Men involved in giving birth. I'm really happy because men, they're even saying, I want to see my baby fasting. You see, it's something encouraging. But those days they were not even able even to come closer. They just want to hear, has he given birth or not? That's the only thing. But nowadays they're supporting them even to know, have you given family planning? And if it's not, they just come back again. You see, mom can review herself. But when the man comes in, she says, no, we cannot go home. If there is as a way of preventing to get another pregnancy, mapema, we just go and get one. It's actually encouraging so much.
Absolutely, makes the work easier. Robina, I've heard something interesting she's mentioned about referral, that they use mobile phone, and then they input the data so that then they can present themselves at the facility.
So the community health strategy team has an EHMIS system where every community health promoter has an smartphone, and the system is uploaded on their phones. So it is a reporting system where each CHP is able to account for the services they have offered within the community. And so they just key into the system, and their supervisors, who are the community health assistants, are able to access and know Hilda has referred 20 pregnant women in the month of May, and out of them maybe XYZ within her household have delivered. So it's an automated electronic system that each CHP has within our county.
And it's important, you are then able to even track the performance, you're able to track impact
against which they are actually given their stipend. Because how do you assess the deliverables through the EHs? So they are actually reimbursed a small stipend against that the reporting of the number of clients, not only pregnant women, it's a full range of services that the CHPs support in our communities.
Absolutely.
Yes.
Peter, final statement, because something that I particularly liked was what you said around you first listen, you go where they are, so that then when you're communicating, you're not imposing, right? Which tends to be that, we're trying to impose, say, the contraceptive and family planning agenda, but you said you listen, you understand, and you're able to engage where they are, so that there's a level of ownership, right? So then, I would ask about the youth in particular. We've spoken a lot about the men, we've talked about girls, we've talked about women, right? Youth in general, given, they're in a phase where a lot is changing, right? How do you keep track of that, right? How do you keep, from the 15, 16-year-old who's quite hyper to, how do you keep track of that,
One, good and excellent training from
Robina, we're about to give you a medal, apparently.
Thank you.
train us. Let me honestly and practically.
Yes.
In those outreaches that we go for, you'll find her speaking the language that the youth speaks.
Yes.
And we'll have what we call youth-friendly activities.
Yes.
That's at that hour, she goes to the level of this youth who is 16.
Yes.
And that's where we know whatever medical practitioners like harsh people. Okay, where Gina, so how she goes to that level. Oh, mniaje mkuu, uni mdenge wako, and then this is friendly, don't talk to me, then niko na morio wangu, and then they refer. You see, that's how we normally do it, and it's doing well. In a community, slums more so, youths more. I'm talking about young men right now. They are looked at as very bad people. They are thugs. They are a threat. So many things. There's a level you can handle them, and then they become your best friends. They will tell you lots of stories. When you handle them like that, it becomes the best. And that's why I'll never, even when I grow old, I'll still work with the youths. I think that's my passion. That's my home.
Yeah, absolutely.
Yes.
I mean, it's great work, both you and Hilda, the work you're doing.
Yes.
I think it's important. That approach of being someone who lives there means that people can walk to Hilda. Young girls at 12 can walk to Hilda, right? The man can say, you know what, I've seen him do it, so I'm also going to do it, right?
Yes.
It's a very powerful approach. And Robina, this medal, we must find it for you. But in terms of final statement, Robina, the community approach, right? The impact clearly is enormous, right? What's the feedback you get? What's the feedback? I mean, you're hearing from, of course, your trainees, but what's the feedback you get from the actual population? You would say they are at least skilled workers at this point in time, but from the community, when you talk to us, as Peter has said, you talk to the youth.
Before she comments, I would like to say that Robina is a hardworking.
You see, medals, they continue.
I'm not praising her, but actually she also makes me to be hardworking.
Yes.
For one, she knows how to keep time.
This we have seen.
Yes. If it means in 7, let it be 7.
Yes.
The latest time would coming to the facility used to come at 6:30. The latest 7.
Yes.
So you find these mothers who wanted to have family planning. She gets earlier before leaves to job. So I appreciate her. Yes, I always appreciate her. Wherever she will, I always appreciate because of her hard working. These are very humble and very hard working.
Absolutely.
Yes.
And a lot of this must be passion, Robina.
Yes.
Most of it is because for a family plan, for someone to take up a family planning method, Dr. Diana, you are the healthcare provider with the skill, with the knowledge, with the facility, a space to serve,
Yes.
and the method. So you are the one to standing at a crossroad for a better future for this lady, or deny them the method, they get pregnant and draw back their progress by this number of years with the pregnancy. So what would you rather do? Stand at that junction and offer the method and add value to the life of this pregnant or of this lady
Yes.
and young person. Maybe it's I used to share sometime, and most of the facilities, especially public facilities, have been deemed to offer services up to a certain time.
Yes.
So we used to have conversations, and these are conversations that we're still having. You are the healthcare provider. On a Friday afternoon, a young person comes to you. She's so sure that she has a date with somebody. Then you are the person to deny them the service? Is it right? So speaking of passion, again, when you have such conversations with colleagues, and you remind them that it is not just doing them for doing this, offering this service for them. This could be your daughter.
Yes.
You're seated in this facility. Your daughter is getting services elsewhere. So why don't you extend the olive leaf and just serve people, serve communities, impact lives?
Absolutely.
Yes. So that is the motivation behind the passion. That if I am the one to support this life and help this young person go through university safely without having another burden of pregnancy,
Yes.
when they graduate, they will remember there was a service provider somewhere who supported me.
Yes.
Absolutely.
Yes.
Really, it was a privilege having you. Yeah, it really, really was.
Thank you.
Asanteni, and continue with the good work. Invite us to see some of it. We shall come. Yeah. Thank you. Thank you. Thank you so much. And thank you so much for joining the One Health Lens podcast. We'll continue this conversation.